Hi, good afternoon. My name's Linda Chezem. I am a retired judge from the state of Indiana. I served as a trial court judge on the Indiana Court of Appeals. Then I went to Purdue, and I am a professor emerita of youth development and ag education. So today we're going to be talking about fetal alcohol spectrum disorders. And the reason that I have focused a lot of my work on fetal alcohol spectrum disorders is they are often undetected. They're complicated, where on the spectrum, how much disability, how do we know what we're seeing? There are lots of rather complicated questions around the diagnosis, the detection of fetal alcohol spectrum disorders, and they're devastating. Because they're not often recognized, families suffer a great deal, and we know that the whole point of this talk is to figure out what can we do about fetal alcohol spectrum disorders, and particularly looking at the justice system for a response. So I've given you my email. I'm linda@foleypeden.com, which is a law firm in Martinsville, Indiana. I will be happy to email you my slides if you would like them. And I thank you for helping to prevent paper waste by not having to print them out. So what are we doing today? Well, we are going to identify and describe the most common characteristics associated with fetal alcohol spectrum disorders. We're going to assess the justice system responses to fetal alcohol spectrum disorder related characteristics. And we're going to do a preliminary evaluation of practices and strategies that might improve the justice system management for persons who have a fetal alcohol spectrum disorder. First of all, this is so important. Fetal alcohol spectrum disorders are caused by drinking during pregnancy. Any drinking during pregnancy presents a potential risk to the unborn child. We don't have a safe level of alcohol consumption when it comes to fetal alcohol spectrum disorders. And the other really important thing is fetal alcohol spectrum disorder is the only birth characteristic that has deficits that's preventable. In other words, if mom doesn't drink for 9 months until the baby is delivered, we have prevented a fetal alcohol spectrum disorder. So 2 things. Any drinking poses a risk at this time, and 2, fetal alcohol spectrum disorders are totally preventable if we can help mom not consume alcohol. So we have a bill introduced now in Congress just this past week, and I want to make, past couple of weeks, I want to make sure you are aware of it because it's a really important bill. And it's the Advancing Fetal Alcohol Spectrum Disorders Research Services and Prevention Act, known as the FASD Respect Act. And the Senators Murkowski and Klobuchar and the Representatives McCollum and Young are the sponsors and co-authors of this bill. And this is important because it actually appropriates $118 million to be used for services around the screening, prevention, detection, and treatment of fetal alcohol spectrum disorders. So keep this bill in the corner of your mind, and long after we finish today, keep it at the forefront of your thoughts. So anytime you're talking to a representative or senator, you can encourage them to sign on to this bill, to support this bill. I'm going to give you a quick history now, because we just saw what is really good news, the new introduction of a new bill. But we have a history here in terms of dealing with fetal alcohol spectrum disorders that's interesting and will help highlight why you should really help get the Respect Act passed. In 1690 through 1751, there was a gin epidemic in England. Gin was cheap, plentiful, used as payment for work, and there were a lot of babies born with fetal alcohol spectrum disorders as a result of this gin epidemic. And eventually, England realized that gin was a problem and passed a series of 3 laws and were able to decrease the consumption of gin. In the United States, a significant piece of legislation was prohibition, the 18th Amendment to the United States Constitution. And you're thinking, well, why wouldn't making the use of alcohol illegal prevent alcohol misuse? It actually had a reverse effect, and it's almost like prohibition erased everything our society knew about alcohol. For example, as a result of prohibition, cocktails became popular and were more readily consumed, especially by women, because they were sweetened with fruit juices, and flavors were added to hide the unpleasant taste at times of the homebrew, the illegal bootleg alcohol. So the 18th Amendment actually, I would argue, had a reverse effect from its intended effect. And then in January 12th to the 18th, 1986, we had Fetal Alcohol Spectrum Disorders Week to call attention to fetal alcohol spectrum disorders. And that came about partially as a result of a law regarding fetal alcohol spectrum disorders that was passed in 1983. The point of this is we have had legislation, constitutional amendments, and formal weeks declared, and really not made the impact we need to make to decrease, prevent, and eliminate fetal alcohol spectrum disorders. So back to the new bill. As I said, it's bipartisan, and it's to provide comprehensive services, public health prevention and research programs, and across health and human services, education, and justice. NIAA is the National Institute on Alcohol Abuse and Alcoholism, and NIAA's research is translated to inform the general public about alcohol. And the research agenda is to find the knowledge that will decrease the health burden of alcohol. Therefore, fetal alcohol spectrum disorders are a very legitimate and important part of the NIAA work. We have a federal interagency coordinating council on fetal alcohol spectrum disorders that was intended to improve cooperation, communication, and collaboration across the federal agencies and across disciplines. And I've given you the website here for the ICCCFASD. It is chaired by the National Institute on Alcohol Abuse and Alcoholism. I've been involved with it since 2003. I was very involved with the Justice Issues Work Group. So the Justice Issues Work Group was really trying to provide an agenda, provide education and outreach, all focused on what's happening in the justice system with the fetal alcohol spectrum disorders. Now, keeping in mind that NIAA does research across the lifespan, starting with the fetus and the effect of alcohol on the fetus, and then all the way to where someone is a senior. And what we know is the alcohol plus the environment, alcohol plus the genes. So understanding how to screen, how to prevent, and how to treat alcohol consequences requires that the research really look at the environment and the genes and a whole environment, including where the person is in the lifespan. So we know, for example, critical knowledge about alcohol is that ethanol, which is what you're drinking, crosses the placental barrier. Mom drinks, baby drinks. That's all there is to it. However mom drinks, however much, how frequently, baby drinks right along with her because the ethanol crosses the barrier. What we also know is that fetal alcohol spectrum disorders is an umbrella term for a variety of diagnoses. This is where the complicated piece comes in because it's not really easy to say, oh, we know this child has a fetal alcohol spectrum disorder because the alcohol taken at different times has different effects, the amount taken. There are many different outcomes from mom drinking. And so I have a list here of fetal alcohol syndrome, prenatal fetal alcohol syndrome, fetal alcohol effects, and we'll define some of these in a later slide. So the common characteristics, and again, this is another part that makes it difficult. A lot of people have an image of fetal alcohol spectrum disorders of eyes situated a certain way, a smooth philtrum, in other words, facial features that supposedly are diagnostic of a fetal alcohol spectrum disorder. And yes, those features can be part of the diagnosis, but what we know is that a child who was exposed in utero to alcohol may not have the same severe facial characteristics as a lot of people think equals fetal alcohol syndrome. What we know is there's a spectrum, a kind of a sliding scale, if you will, of characteristics. So prenatal alcohol exposure can cause significant neurodevelopmental and behavioral disorders, as well as adaptive and self-regulatory impairments that will last a lifetime. FASD includes FAS, partial FAS, ARND, and alcohol-related birth defects. And the symptoms, if you will, or the characteristics are congenital abnormalities that include malformations, dysplasias of the cardiac, skeletal, renal, eyes, and auditory and other systems of a child. The alcohol-related neurodevelopmental disorders, ARND, has central nervous system neurodevelopmental abnormality that is evidenced by decreased cranial size or structural brain abnormalities, or neurological hard or soft signs in a pattern of, and this is important, confirmed excessive maternal prenatal alcohol use. I think there's a really important piece here that confirming mom's use of alcohol confirms that it is indeed a fetal alcohol spectrum disorder. But many times we can't confirm mom's use for whatever reason. When we see a child or a teenager, mom may be long gone from the scene. Even if mom is still there, she may not know or be willing to share anything accurately about her alcohol use during the pregnancy. So, in plain language, someone with a fetal alcohol spectrum disorder may have difficulty learning and remembering. Not always. Some of these kids are really quick learners, very quick learners. But that same child that can learn quickly may have difficulty understanding and following directions. And following directions is part of their executive skills. If they can't go upstairs, brush their teeth, put on their jammies, and go to bed, they may go upstairs and then wander off and not brush their teeth and put on their jammies and get into bed. And that's because they don't have that ability to actually carry out the instructions more than one or two steps at a time. Shifting attention. And we expect that somewhat from all kids. You know, you have a little kid and you're talking to them and they see something, a dog run down the street, and their attention goes to the moving object. But for a child with fetal alcohol spectrum disorder, there may be nothing there to trigger the shift in the attention. They just don't stay focused. Controlling emotions and impulsivity. Again, it may be a child who, falls apart over something that you would not expect them to have such a breakout over. It's interesting because it's the amount, to what degree that these symptoms are expressed, because people without fetal alcohol spectrum disorders have these different symptoms, or we have these different challenges. Communicating and socializing. I could have a entirely different diagnosis and not be someone who has a fetal alcohol spectrum disorder. But again, for the population that has those, this is one of the really important skills. The communication skills do not seem to be as sophisticated or as competent as in someone who doesn't have a fetal alcohol spectrum disorder. Performing daily life skills. They may not eat right, they may eat irregularly, they may not want to eat nutritious food. Bathing, counting money, telling time, minding their own personal safety is a huge disability. They are not able to discriminate against who's safe and who might not be safe. And situations that you or I would see as dangerous, they may not see the danger. If they're standing in the middle of the street, there's no car coming right now, they may not feel the danger that you or I would feel, knowing that sharp curve often has speeding cars come around it. So again, I think this is the plain language list, but they're not all that different from people who don't have a fetal alcohol spectrum disorder. It's just that they have more of them, and the intensity of the disability is greater. This particular slide shows the difference between a baby whose brain has not been exposed to alcohol and a baby whose brain that has. it's to me, it's just a really sad slide. You just want to weep and say, how could we let this happen? This slide is another slide, but it doesn't trigger emotion for me as much as the previous slide. It's very matter of fact, just saying, look, alcohol, when the alcohol crosses the placental barrier, it literally bathes the brain in alcohol. And as you can see from this diagram, all parts of the baby's brain are affected by the alcohol. And that's why there are so many different disabilities in the spectrum. And again, we are doing research, trying to understand how to maybe fix some of the deficits. There's been research on diet, there's been research on dietary supplements, but right now there is no cure for a fetal alcohol spectrum disorder. What does that really mean? Well, it means that we have people who look perfectly normal, who may be smart, who have kind hearts, who are loved by their families, and they cannot address routine life situations well. They make bad decisions. They make the same bad decisions again and again. They trust the wrong people, and they don't understand why the consequences of their action occur to them. They just really don't understand. There's this gap, if you will, between the action and understanding why it had the impact. Fetal alcohol spectrum cases, we believe, are seriously underdiagnosed. It's difficult for a practitioner to distinguish between other developmental disorders because they share learning and behavior problems and patterns. We also know that the fetal alcohol spectrum disorder means that the person is more likely to suffer from attention deficit hyperactivity disorder, ADHD, depression and anxiety, problems with hyperactivity, conduct, and impulse control. And what is really scary, I think, is the fact that we have seen that there is an increased incidence of alcohol and other substance use disorders when a person has a fetal alcohol spectrum disorder. So it's not that only this child has been harmed by alcohol, but it may be that this child will have an alcohol use disorder that harms the next generation. So, looking at the justice system, because I know that's what you were expecting to do, the traits that are common with fetal alcohol spectrum disorders, and as you know, get people with fetal alcohol spectrum disorders in trouble with the law. They are childlike, naive, trusting, friendly, have a strong desire to please everyone as their friend. How does this get them in trouble? Well, they do favors for people they don't know, and they don't understand those favors are bad, and they shouldn't do them. Another way is police officers are a friend. And you know how we tell kids, if police are your friends, you're lost, go to the police officer. Well, they want to please the police officer. So, yes, they killed Susie or whatever. They are hyper willing to confess to a crime that they may have had nothing to do with, not even been present at, because they want to please. Another characteristic is they have no fear, no sense of danger, and they are impulsive. So they're with a gang of friends and somebody dares them to walk into a store and shoplift. Why not? What's dangerous about that? What's going to happen to that? And so there are other examples I could give. Their social skills are below their chronological age, makes them very vulnerable to exploitation, both sexual and otherwise, because they don't have strong social skills. They want to be accepted and part of a group, a gang, if you will. And so what do they do to get acceptance? They sometimes engage in behavior to their detriment in order to get that acceptance, to get that social ability. They are often concrete thinkers. If you tell them not to cross that line, they probably won't cross that line. Then they'll stand there. If there's a train or a car or something coming at them, they don't move out of the way because you told them not to cross the line. They also don't have a good concept of time. So if there are curfews, they may be out past curfew. They may have been told by mom or dad to be home by 9 o'clock and they wander in at 12 o'clock. Maybe they're going to walk to school and they get sidetracked. There's something exciting over there. Or what was that car going? And they're late to school because they don't really, they get a tardy demerit because they don't really understand the time has passed. And probably, I don't know if it's the most serious trait, but the difficulty in understanding the link between their behavior and the consequence is really problematic. They don't really understand why they shouldn't pick up that pretty jacket and take it home, or they want a piece of candy. Why shouldn't they eat it? They're hungry. They don't make the connection that they don't have the right to that jacket or that piece of candy, and that actually it's stealing for them to eat the candy or take the jacket. They do not see that link. One of the really interesting descriptions I heard several years ago about, and this was a young man in his 20s, but his mom was describing him, that she had to just think younger. She knew how old he really was, but in terms of giving him privileges, assigning him responsibilities, and supervising him, she had to remember he didn't calculate to his chronological age. So, for example, an 18-year-old with a fetal alcohol spectrum disorder may talk like a 20-year-old, may look like an 18-year-old, read like a 16-year-old, comprehend like a 6-year-old, have the social skills of a 7-year-old, and have the emotional maturity of a 6-year-old. And I think we've seen adolescents who have no emotional maturity. You can hear them in public places, and they just you wonder what's going on with that person. It may be a fetal alcohol spectrum disorder. It may be another disorder, but for fetal alcohol spectrum disorders, if you look at this list of the responses for an 18-year-old who is legally an adult, you can see how treating that person like an adult is actually not justice. They can't cope at that level. They don't have that developmental level. So when you treat them as an adult, put them on probation, they're not going to be successful without accommodations to their abilities and their level of abilities. I like this fact sheet, and I put it up here as kind of a change of pace because it sounds really discouraging what we believe, and you'll hear different statistics. I understand that. But if 1 in 100 children have a fetal alcohol spectrum disorder, that's significant. We need to pay attention here. And ideally, we could simply prevent all fetal alcohol spectrum disorders. So this is kind of a nice flyer if you want to start the conversation about what should we be doing about fetal alcohol spectrum disorders in the justice system. And I would suggest that maybe we need to start pre-justice system and start with the pregnancy. Look at what happens during the pregnancy. 1 in 13 women say they drank while they were pregnant. 1 in 100 children have an FASD. I guess we're just lucky that 1 in 13 children don't have an FASD. But that doesn't mean we shouldn't be educating women of childbearing ages and their partners about the danger of alcohol consumption while pregnant. So we also said we were going to evaluate justice system responses to fetal alcohol spectrum related characteristics. There are no simple answers. When you look at the justice system, depends on your jurisdiction and even which court in your jurisdiction, which police agency in your jurisdiction, which prosecutor's office, and which probation or parole office. The responses vary from totally unaware of fetal alcohol spectrum disorders, they have no idea, to communities that have committees and have some programs. And as you think about this, I hope you will inventory your community looking at the components of the justice system. You have the law enforcement component. Do law enforcement officers understand about a child with a fetal alcohol spectrum disorder? Some places, parents have given their kids cards to carry to tell the police officer they have a fetal alcohol spectrum disorder. They are not able to respond as someone who doesn't have that disorder. They want to call their parents and they want to call an attorney. And those are not all that common, but I think they are a very good start towards two things. One is protecting the child and educating the police, both of which are important. Which jurisdiction is going to make a big difference? Some states are far more aware of fetal alcohol spectrum disorders than others. Alaska is one. Minnesota is huge. Portland, or Oregon actually, also, and Washington, the state of Washington. So depending on the jurisdiction you're in, you may have a fairly strong justice system response that engages the components from the street all the way through the process, or you may be in a jurisdiction like Indiana, which, who knows? It is very happenstance in Indiana. So when you think about the justice systems, we tend to think about criminal, right? Criminal always pops up right in our head first, and that may be a mistake. But the interrelated layers of law enforcement, forensic science, the judiciary, and corrections need a coordinated response to FASD. So we don't look at the civil side of the agencies that are part of the justice system, the administrative agencies, Health and Human Services, Child Protection Services, courts, civil courts, dissolutions, who gets custody of the child. What if mom also has a fetal alcohol spectrum disorder? What if mom and dad have a fetal alcohol spectrum disorder? Can one or both of them care for the child? And of course, juvenile court for children who are in need of services, as well as delinquent children. All of these are very important components of the justice systems. And I mean, first of all, I'd like to see services, right? But the services would be so much more effective if they were coordinated across the agencies. Now, I've given you a list here of resources that are quite fascinating, really. I think they're all federal resources except for NOFAS. And NOFAS is the National Organization on Fetal Alcohol Syndrome. And NOFAS is private, supported, non-governmental, an NGO, a non-governmental organization. The rest of the groups I've listed, American Academy of Pediatrics is also an NGO. The Collaborative Initiative is an NGO. I apologize. So we have a group of NGOs, and then we also have NIAA and CDC and SAMHSA. They actually do research and programs around fetal alcohol spectrum disorders. So with those resources in mind, let's consider how would you evaluate strategies and practices. It's important to know what screening practices are being used and whether those screening practices have been evaluated. And in this slide, I have a list of some resources that would help you determine what screening mechanism probably is most accurate, effective. The systematic review and meta-analysis by JAMA is one. Take a look also at what pediatric providers need to know. If children are seeing a pediatrician, hopefully the pediatrician is looking and being alert to the possibility of a fetal alcohol spectrum disorder if the child is having a problem. Strategies to improve justice system results. Do you have experts available to diagnose and testify? If you want to get a better result, you need to have the diagnosis so it supports the provision of services and programming. So the strategy would be making sure you have the experts. Do you have doctors and other trained persons available to supervise the provision of the services in an appropriate manner? Supervision sometimes is in the eye of the beholder, and right now I understand COVID has turned everybody's apple cart upside down, but again, the appropriate supervision is critical when you're dealing with someone who doesn't know and doesn't have the ability to say they're not getting what they need. What programs are available to persons with an FASD and their families? Because it's critical that the families have support and services so that the person can continue to live with the family. Are those programs even relevant? And sometimes they're really not just relevant, they're probably harmful because their expectations don't take into account the common characteristics of FASD. Are they effective? There's no point in ordering programs or getting programs ordered if they're not effective, if they've not been evaluated to make sure that they actually do what they say they'll do. So the next step, this is, again, kind of a tough one, because we like to think that our staff, our personnel already are the best and they know what they need to know. But the truth of the matter is, justice system staff often barely know what FASD stands for, let alone have any information in depth. So from the street, the police officer, the law enforcement officer, to the court, to the home, to school, to the community, are there educational opportunities available for staff in each component that are supported by research, replicable, monitored for adherence, and cost-effective? And I want to slip back to monitored for adherence. When you have a program that has been proven to be effective, it is only effective if you stick to the program. More resources for you to take a look at, and in terms of the justice system, this group, Canadian Justice, FASD Justice, has a lot of resources, good materials. So does NOFAS. Both are very strong programs. So to start concluding, individuals with FASD can appear on every court docket. They are not limited to juvenile court, criminal court, civil court, dissolutions, or domestic relations, whatever you call it. They are everywhere. And that's an important piece. This is kind of your FYI section, just things that I would like to remind you as you think about how to work with a mother who is either pregnant and drinking, or who has a baby and was drinking during the pregnancy. Keep in mind addiction, what addiction is, impaired control, compulsive use despite negative consequences, chronic relapsing disorder. Keep that one in mind. Add to this that alcohol dependence, alcoholism, is a common complex disease. It is influenced by different genes with different effect sizes and in different combinations. So you have gene-gene interactions, and you also have gene plus environment interactions. What does that mean? That means that this is indeed FASD, often undetected. It is complicated and it is devastating. Thank you so much for joining me this afternoon and thinking through the complexity of fetal alcohol spectrum disorders and thinking about how can we make a very well-organized, long-lasting approach to programming and care, both for mom and the baby. And above all, don't forget about the Act, Respect FASD. Thank you very much.